Hola amigos, I'm Coach Darwin and welcome to the channel. If you're having any shoulder pain, especially if there's any catching or clicking or popping when you lift your arm up in the air, you might have a slap tear in the shoulder. In this video, I'll go over everything you need to know about a slap tear, including a few exercises that you can do that can get you out of pain. Keep watching. In this video, we are talking about slap lesions or slap tears of the shoulder. And what I want to do is go over the anatomy so you understand the structures that are involved. I want to talk about who are risk factors, who are the patients we typically see who develop slap lesions. I want to talk about some of the symptoms that would lead you to believe that a slap lesion or slap tear might be indicated. And then I want to talk about different types of slap lesions and which one of those might require surgery and which one of those might you be able to just get by with doing some recovery or rehabilitative exercises. And then I'm going to give you 3 or 4 exercises that you can do on your own if you're suspecting that you might have a slap tear and you want to try to get it done without surgery. So let's get started. Now let me back up a little bit. A slap tear, SLAP, stands for superior labral anterior to posterior. Now what that's doing is describing exactly where the tear is located in the tissue. Now the shoulder joint itself is a ball and socket joint where the socket part is part of the shoulder blade or scapula, and the ball part is the ball of the humerus or the upper arm bone. Now those two bones articulate in this joint, and the socket part of the scapula, the shoulder blade, is actually very narrow or very shallow. And what that allows then is for us to get a lot of motion in the shoulder, which is great because we need a lot of internal rotation, external rotation, horizontal adduction. You need just all kinds of planes of movement for that shoulder with daily life and for sports. The problem is because that sits in there so shallow, you have a risk of dislocating, which is something you certainly don't want to do, and maybe we'll do a whole other segment or video on that some other time. But now what the body has done, the body's very clever, so now it's given the shoulder this ring of fibrocartilaginous material or connective tissue, basically to increase the size of that socket, so the shoulder, the arm bone can sit in there a little bit deeper, so it's a little bit more safe. Now the shoulder also has all of these muscles called the rotator cuff muscles collectively, which help keep that humerus or that arm bone in place in that socket as well. That's kind of a dynamic stabilizer of the shoulder to help keep it in place. We're talking about the labrum now, which is the labrum again is that connective tissue that surrounds the glenoid of the shoulder blade for the arm bone to sit into. The patients that we typically see with slap tears are people who do a lot of overhead repetitive motion. So especially among our athletes, the pitchers, tennis players, volleyball players, a lot of, over the years, just a lot of overhead action and kind of repetitive trauma is going to cause this tearing of the labrum. Now there's a few different reasons or causes that would predispose someone to this injury, and with a lot of overhead motion, what can tend to happen is athletes or just humans in general can develop a muscle strength asymmetry where their shoulder internal rotators are a lot stronger than their external rotators. And so what you're going to do then is, if you have that imbalance, is the muscles that are stronger are going to pull a little bit more without that counterbalance of the antagonist or opposite muscle. So strong internal rotators, which is when you think of spiking a volleyball or serving a tennis ball or pitching a baseball. It's all of that strong motion there with a lack of a counter of external rotation strength. The other issue that we can kind of see is that we develop a tight posterior capsule of the shoulder which then forces the arm bone to migrate anteriorly and superiorly, and then that abuts onto that superior aspect of the labrum. So it's no surprise then that we're getting a tear, the superior aspect of the labrum, anterior to posterior. Voila, the SLAP lesion. Now, there are 10 different classifications of SLAP tears, but at risk of overcomplicating it, let's just break it down to 4 different types. Now, as we talk about the different types of SLAP lesions, the first type being just a partial tear and degeneration of the superior aspect of the labrum, where everything is just kind of frayed, but the labrum itself is not detached at all. Now, as we move into a type 2 lesion, this is actually the most common of what we see. And this one is where the superior aspect of the labrum is completely torn off of the glenoid, and it leaves a gap between the cartilage and the labral attachment to the actual bone. Now, as we move into a type 3 tear, this is one where we call it a bucket handle tear of the labrum, where the labrum actually hangs into the joint. And this is one of the ones where the patient will typically experience blocking or catching because that piece of the labrum is actually into the joint and blocking that motion. The fourth type of SLAP tear is one that extends all the way down into the biceps, the long head of the biceps tendon origin. So in this one, there's a little bit more involved with surgery to reattach the biceps tendon. Typically, a type 1 SLAP tear might not require surgery necessarily. Now, these are the types that we might be able to treat conservatively with physical therapy and exercise and symptom management. Whereas the other types, consult with a physician, a surgeon, and they can make the best decision with you if you think surgery is going to be required. And then following surgery, there's a protocol, a pretty defined protocol to help get you back on your feet and make sure that tissue stays healthy along the way. Now, symptoms of a SLAP tear is you're going to have just a lot of pain, typically in the shoulder region itself, with a lot of overhead motion. Your shoulder's going to let you know that something doesn't feel really good in there. That's the hallmark presentation of a SLAP lesion, especially once you get your arm into positions of elevation and external rotation. And there may or may not be a biceps component of this, so any contraction of the biceps could aggravate the pain that you're having. Now, if you're in one of those types that we talked about, you might actually get some clicking or popping or catching in the shoulder itself as you go through these motions. Now, if we're talking about a type 1, or even if you're waiting for surgery on any other type of SLAP tear, there's a couple things you can do to reduce the symptoms that you're having. The first thing, and probably maybe obviously, is to stop doing the motion that is aggravating the symptoms. So if you're an athlete, I'm not telling you to stop doing the sport-related activities, just stop doing the ones that are aggravating the shoulder. So that way you don't have to stop doing the sport altogether. I know that's a bridge too far for most athletes, and we want you to continue to exercise, through other aspects of the sport while we get your shoulder going the right direction. You might take things like NSAIDs or non-steroidal anti-inflammatory medications. These are like ibuprofen or Motrin or Aleve to help reduce some of the inflammation that's in the joint. You can also ice it, and that may just relieve some of the symptoms that you're having as well. If you want to get started trying to rehab or recover your shoulder in the absence of surgery, stay tuned and we'll go over those videos right now. If you wanted to dig deeper into this and actually you're decided to have surgery and wanted a more of a protocol approach to recovery, I'll leave some details in the comments below as to where you can find an eGuide that I've produced to walk you through that process. So if you're ready, let's get started with those exercises. Okay, so before we get started with these exercises, it's important to just know that you're not working through any pain with these exercises. Have a conversation with your doctor, your physical therapist. Make sure you're okay to do these exercises first, and then let's see if we can't get the shoulder feeling better. Okay, so what we're doing with these exercises is trying to support the shoulder joint itself while minimizing the amount of work that's happening at the biceps tendon. So the biceps here, so we want to make sure that we're not exerting any force by the biceps because that anchors here at the top of the labrum. So we're trying to eliminate any of that, so make sure you're not doing any bicep curls at home. Now, the first thing we're going to be doing is trying to stretch out the shoulder capsule. There's a couple different ways. I'm going to go over this with you. We're going to try the first one. It's a little bit more aggressive. And then we'll try the second one if this one is causing too much pain. So you're going to start by lying on your side. We call this the sleeper stretch. Your arm is going to be at about a 60-degree angle, so not quite horizontal, but just about, a smidge down from that. So from here, what you're going to do is keep your elbow up to 90 degrees. With your other hand, you're just going to press down this way. This is going into internal rotation of the shoulder. You're going to feel that stretch probably in the back of the shoulder joint here. Get a good stretch, hold it for about a 30 count, and then come back up. Again, we're not looking for any sharp pain as you do this. And you'll notice kind of as you do a few more reps, you probably get just a little more give each time. So try this one, hold each one for 30 seconds, try it 3 times. Now, if that's causing too much pain and you're not able to do that comfortably, you can also just pull your arm across your body this way. Now, with your good hand, you're going to just exert a little bit of force on the elbow into the body. And again, what we're getting is a little bit of stretch in the back here of the shoulder. I like to just make this just a little bit more intense, and by rotating kind of that thumb down, the elbow comes up a little bit. You're going to get just a little bit more of a stretch in the back of that shoulder. Again, hold these for about 30 seconds and try it 3 times. Good. So that's stretching out the shoulder capsule. The next thing we want to do is work on a little bit of strength on the muscles surrounding the shoulder to kind of help support it from where the injury of the slap lesion is. So if you have a dumbbell at home, a very light weight, you want to grab that. Or if you have a can of soup or something like that, go ahead and grab that. That just might weigh a pound or 2. And I live here in Mexico, so my weight of choice is going to be this frijoles negros enteros, so black beans. All right, so with this exercise, you're going to need to lie on a sofa or a bed or a massage table, if you will, and you're just letting your arm hang down towards the floor. From here, what you're going to do is just row up, so get that elbow up nice and high. Now from here, we're going to turn the wrist and just come into what we call external rotation, but you're just bringing that arm up this direction, go to pain-free range of motion, and then rewind back down and then down to the floor. So we're going to aim for sets of about 10 to 15 repetitions, whatever your shoulder is able to do. You're just lifting up, turning, and then lifting up this way and back down and down. Okay, very last exercise, you're strengthening very gently the rotator cuff muscles. And the rotator cuff muscles are really important because they attach from the shoulder blade into the humerus, so the arm bone. So it kind of helps keep it in place in the socket where it needs to be. So from here, you're going to be lying on your back. Arm is at a 90-degree angle this direction. You're holding onto your can of frijoles. And you're just going to let the arm sink back this direction into external rotation. Find a nice little stretch there. And then you're just going to rotate forward. Take it as far as you can. Notice that my elbow is not lifting up off of the table. You want to make sure that it stays down and supported. And you're just going to cycle back and forth, nice, slow, and controlled through the amount of range of motion that your shoulder is going to give you.
And as it falls back, you got to really control it. It's kind of eccentric training, we call it, or eccentric strengthening. So we're really kind of fighting gravity as we go. Back and forth. And do this for 10 repetitions and try 2 sets. All right, so those are just some very simple exercises that you can try on your own. Again, not to work through any pain with any of those. If you want to get a little more in depth with some of these exercises and have more of a advanced protocol for exercising, if these are too easy or too hard, I'll drop down in the comments below a eGuide that goes over all of those exercises in more depth. Good luck, and please let me know if you have any difficulty or any questions down in the comments below.